Hi, before starting the presentation, I would like to introduce myself. I am Venkatesh Poddu, PhD scholar at IIT Hyderabad. I did my Master of Arts in Anthropology from University of Hyderabad, then did MPhil from IIT Hyderabad and later joined in PhD program. My MPhil research was on fluorosis in Nalgonda district of Telangana region. And apart from this, I am interested in topics like disease etiologies, disability, male infertility and masculinity, and public health policies in India. Today I am going to be talking about lay understandings of cancer. The title of the presentation is I thought it was the end, but it is not. The patient's experiences of cancer in India. Now, before going into the actual presentation, let me introduce my co-investigators. Dr. Mahathi Chittam is an assistant professor in the Department of Liberal Arts, IIT Hyderabad. And Dr. Senthil Rajappa is an oncologist at Baswatarakam Indo-American Cancer Hospital, India. And Dr. Rebecca Bacon is a senior research associate, University College London, UK. Now, let me take you to the quick background of this study. The existing research says beliefs and attitude towards the illness are found to be influenced by the patient's help-seeking behavior. And it is seen that individuals who feel that their symptoms are trivial tend to delay approaching their physician related to their illness. And it was also seen that patients' beliefs about their treatment and also attitude towards the pain tends to influence their quality of life. And individuals' control related to their illness were also found to be related to the adjustment with their illness. It was seen that women with breast cancer who felt their illness was controlled by external factors had more adjustment issues. And finally, individuals' perceived control about their illness was also found to be related to their psychological distress. So, coming to research in India, one study has looked at awareness about the illness and its relation to psychological distress. Another study has also looked at how patients' beliefs and attitudes towards their illness influenced their intentions to seek help. These studies mainly highlight how a patient's beliefs and attitudes influence on his or her help-seeking behavior and adjustment issues. Since there is a lack of qualitative research on understanding psycho-oncology, our study is going to be the first in this category. And coming to the aim of this study, we tried to explore cancer-related beliefs, help-seeking experiences, adjustment, and attitudes among cancer patients in India. That is, the link between patients' beliefs, attitudes about cancer, and help-seeking behavior. And coming to the methodology section, 11 patients were recruited from Indo-American Cancer Institute and Research Center, Hyderabad, India. The time since diagnosis varied from 3 months to more than a year. Semi-structured interviews were conducted in private with patients. The interview topics are listed below. Help-seeking experiences, mainly focusing on diagnosis seeking, reaction to cancer diagnosis, beliefs and attitude towards cancer, experiences of cancer, and coping with their illness. The average length of interview was 44 minutes. All the interviews were transcribed and analyzed using IPA. The patients' details can be seen in this slide. There were 5 female patients and 6 male patients. The highest level of education was post-graduation and the lowest was 8th grade. The average income is 30,000 per month and the average age of these patients is 48. The major themes emerged from this study are delay in seeking diagnosis, reaction to the cancer diagnosis, conceptualization of cancer, worries, coping, and attitude towards cancer. So, when we explore more on why there was delay in seeking diagnosis, we found delay in seeking diagnosis was seen where individuals reported experiencing fear after hearing the diagnosis. And secondly, there was also lack of awareness about their illness. And some of the individuals also reported feeling of regret due to the delay in diagnosis. And coming to the patient's reaction to the cancer diagnosis, we found individuals experience negative reaction after hearing about their diagnosis. And Individuals reported disbelief about the diagnosis. They wanted to seek answer about the cause of their illness. And finally, they reported feeling of anger towards the illness. And when we tried to explore more on how patients understand and conceptualize their illness, we found the individuals conceptualize their illness through describing their illness. That is, one of the patients explained it as Rajapundu, which literally means the king of wounds. So he thinks this is the biggest wound he has. And some of them also gave casual explanations to karma and past life. Since the patients felt they have very less time, we tried to explore more on what are their worries. So we found individuals experience worries related to their unfinished business, family responsibilities, and also side effects from their illness on their quality of life. The various coping strategies used to deal with their illness were like positive reinterpretation and acceptance. They said that they need to eat good food to cope with their side effects, and they also accepted their illness by saying they were responsible for their own illness. Continuing on the coping strategies, we found social support helped them to cope with their illness, and patients also taking it positively and feeling resilient to their illness. And finally, physician support also helped them to cope with their illness. And coming to the patient's attitude towards cancer, we found individuals maintain a fighting spirit and also a belief that it is curable. Hence, individuals showed a more positive attitude by having a never give up spirit. So, we conclude saying Indian patients delay in seeking diagnosis due to fear and lack of awareness. That subsequently led to feeling of regret, which is an important finding. Further, the findings indicate that patients once diagnosed continue to rely on their direct experience of cancer as a primary source of information or conceptualization about their illness. Although all the patients in this study reported having negative reactions to their diagnosis and worries, they used a range of coping styles and kept a positive attitude towards cancer. This suggests that, in spite of their negative perceptions of cancer, they were able to reframe the disease positively. And finally, coming to the implications, the key findings in this study were that patients reported lack of awareness of cancer and conceptualized the illness after being diagnosed. So, it is highlighting a gap in current cancer awareness programs in India. Hence, it might be useful to explore the effectiveness of including patient accounts of cancer in these programs. Further, longitudinal studies are needed to understand the underlying mechanisms of the shift from having a negative reaction to diagnosis to maintaining a positive attitude towards cancer. And coming to the clinical implications, the patients required additional psychological support to deal with their regret in delaying seeking diagnosis and with their cancer-related worries. In light of the patient describing cancer as a disease that confused them and that they continued to comprehend cancer mainly through their personal experiences of illness, it may be useful to provide patients with readily accessible cancer-related information at the hospital. With this, I am closing my presentation. If you have any doubts or queries, please feel free to email me at la14resch11004@iits.ac.in, or you can also email to Dr. Mahathi at mahathi@iits.ac.in. Thank you very much.